But once again, all participants are welcome to submit their questions. And if our speakers don't mind, we can provide a direct emails from the speakers in some follow-up email so people can reach out directly. Thank you so much once again. And our next speaker is Dr. Claire Tucker, who is a veterinarian, and currently she's a postdoctoral fellow in a hybrid role with appointments in the Colorado State University One Health Institute and in the urgent care and critical care unit of the Colorado State University Veterinary Teaching Hospital. And she's going to talk about interprofessional education. You're welcome, Dr. Claire.
Thank you so much, Valeria. It's such a pleasure to be here. I know everyone at my institute was chatting about this conference earlier this week, and we are just so honored to have been included in the agenda. Like Valeria said, I'm representing the Colorado State University One Health Institute. This is an institute that's been on our campus now for just about a decade and works with all of our 8 colleges to bring One Health work to the forefront. This is our mission statement, and as I've been listening to our presentations this morning, there are so many pieces that resonate with our mission, looking at that intersection of animals, people, and the environment, but also looking at these complex problems through a number of different lenses. We really have 2 supporting pillars. So some of our work is on the right in the traditional humans, animal, and environment space, looking at things like climate change, food safety, infectious disease. We also have a big contingency of researchers who work on the left in the One Health and One Medicine space. So they're clinically trained, either human medical doctors or veterinarians, but who are interested in bringing One Health into their research and their scholarship. I mostly live on the left side, but we'll talk a little bit about the right as well. This presentation really hones in on the training aspect of our mission. I've heard that several of you on this call are teachers and mentors, and so I'm hopeful that what we talk about today can resonate for you there. My goal is to introduce the concept of interprofessional education. This was a new research endeavor for me over the last couple of years. Then I'll talk a little bit about some qualitative research we're doing with several United States-based institutions, and then we'll finish with how to incorporate this into your institutions and your work as well. So I'll start with the WHO IPE definition. This is a very traditional definition. It's been around for more than a decade, and it's simple. It's where 2 or more professions learn about, learn from, and learn with each other to improve collaboration and quality of care. This is really rooted in a hospital-based setting. Multiple healthcare workers. You can picture a physician, a nurse, a pulmonologist, a pharmacist, a social worker coming together and providing patient care in a way that tries to make it the most high quality and the most efficient as well. However, as we're seeing the shifting of medicine over the last couple of decades, interprofessional education has become more and more important, partly because we're focusing on more patient-centered care, partly because a lot of our salaries and the other metrics in healthcare are based on quality and being able to measure those, partly because medicine is becoming more complex and we have to integrate and coordinate care in a way that actually gets the job done. And then finally, because a lot of burnout is happening in these spaces, and we need to make sure that the wellness of our healthcare professionals is protected. So what is interprofessional education and what is interprofessional collaboration not? It's not just shared information systems. It's not a bunch of specialists coming together in the same room and talking to each other without breaking down barriers. It's not reporting out at these meetings, but not actually having a space for collaboration. And I think importantly, down in this right corner, it's not spaces where you do not include the patient or the client in the veterinary case. Making those people part of the conversation and taking away that hierarchy of knowledge, because everyone in that healthcare team, including client and patient, have something to add to that story. These are some of the common themes of interprofessional education, and then delivery in a healthcare setting. So thinking about how to delineate roles and responsibilities. While healthcare is complex, there are some people who are much better suited at doing certain things, and we want to make sure those people do it well. Thinking about ethics, how do we make sure that we're doing the right thing by the patient? When there's a conflict within the team, what are our conflict resolution strategies, largely based on our communication skills. So how do we talk to someone in a different discipline? When I deliver this concept to students, they say, yep, I can definitely talk to another veterinary student. But as soon as I talk to a pharmacy student or a social work student, it feels like we're speaking completely different languages. So making sure we have a common language amongst our healthcare professionals and then more broadly. And then kind of a final and underlying pillar, what does it look like to be a collaborative and high-performing team? As we have talked about One Health within the context of this event this morning, we really think about the intersection of interprofessional education and what One Health can bring to that space. And these are a number of different case studies that some of our partner institutions have undertaken, really looking at the places where healthcare workers are coming together, but you're laying on these bigger societal problems and these really complex issues to where our healthcare workers have to be both informed, efficient, but also very collaborative. So just a couple of examples from our group. I'll talk now about our collaborative work with the COHA institutions. These are several institutions across the United States that have both a medical school and a veterinary school and are looking to help those two programs come together. So basically, we have been interviewing folks across those schools to figure out how they can do that with all of the restrictions in place. Basically, we've looked at, initially we were going to do a curricular review, but actually embrace the power of qualitative interviews. I know there are many quantitative researchers on this call, so it was a little bit scary as one myself to delve into the qualitative space, but we've gotten a lot of good data there as well. These are the institutions involved. We've interviewed 24 total people, about half veterinary, about half human medical, a few other disciplines sprinkled in, and we expect that more interviews will be coming. We do have a truly interprofessional team. So I work with a social scientist as my co-director of this project, and then a veterinary and a medical student who've done the bulk of the interviewing, which is really exciting. For those of you who are new to qualitative research, we started with the raw interview transcripts. We grouped the quotes into themes, and then we've developed codes from that data to be able to write this up in a peer-reviewed way. Really, 4 themes emerged from our qualitative interviews. One was around the definition of IPE. One was around how One Health and IPE come together. What are some of the challenges that we have? And then what is our impact most broadly? I'll hit on each of these with both some of the sub-themes and then a couple of quotes for each of them. So in terms of the definition, yes, we like that WHO definition, but there's this really a drive for something more and a drive for something more universal across our veterinary and our medical programs. There were some folks who pulled out this collaborative practice, thinking about that highest quality of care across settings, but there's a lot of kind of angst in the IPE space to include non-traditional careers and professionals within the definition. So things like law, things like economists, and certainly some of the community care workers that see the patients on a day in and day out basis. So really, we just want to be able to have our professionals work together regardless of their background. We really want to make sure that we're talking about both professionals and students in a long-term space. And I love this one. We really think about IPE as a dance. It's something we do together in partnership that models flexibility, adaptability, and resourcefulness as we build relationships with each other. I think that's a beautiful metaphor for this collaborative work we venture on. The next theme is One Health and IPE. So a lot of the sub-themes, what is the overlap between those two? Is it just adding veterinarians to that conversation? And as we're scaling care up from the clinic to community care or societal health, what is the scope of IPE in those settings? There's a lot of sort of pushback between medical doctors and veterinarians. It feels like medical doctors have a hard time getting the One Health concept. Veterinarians are not as well versed in the IPE concept. And right there is the first place where we start to lose each other. Some of the things that the MDs talked about is how veterinarians are not strong advocates for their profession, and how do we get our veterinary students to do that with more efficacy. But ultimately, we have the same problems and we work through them in similar ways. We have the same goals, and to be able to intersect those is really where our work and our power lies. The challenges for interprofessional education, especially at a medical or veterinary school, is all about time, money, and then how it goes from curriculum into real life. As many of you know, our medical and veterinary students are very busy. These kind of collaborative exercises often happen on after hours or weekends or summer breaks. And really, there's a push to have it be more integrated into the primary curriculum. In addition, if you have 100 medical students and 100 veterinary students, do you have the space to even put those kinds of people together? We don't have as many big lecture halls as I think we need to, or big collaborative spaces. And the tough thing is you can get buy-in in the academic setting, but then does that translate to the first hospital that your learner works in? We've seen several studies that say that that probably isn't the case. So how do you make it more of a lifelong learning process as interprofessional learners and then educators as well? Finally, the impacts of interprofessional education, we really see this as a tool to rise to the demand of the complexity and stress of modern medicine. With the rising mental health crisis within healthcare workers, is interprofessional education and some of these collaborative teamwork-based tools a way to support our healthcare workers? And then is this a way, how do we make sure that our learners are whole people? We want them to be able to communicate with their communities, with their families, with their friends, and crossing these barriers in a professional way can help them garner some of those skills. From just a few quotes, there are a lot of people out there who think this kind of education is how problems will get solved in the future. IPE is all about, I don't know the answer to this, but this person probably does. And how do I make sure that I communicate with them effectively? And then the recognition that our healthcare is so complex now, but all professions are recognizing that they don't interact in isolation and that a teamwork-based approach is most important. So just a few best practices in IPE if you're working with learners or students, beginning these team science collaboration skills early in the process, making sure they occur throughout the program, making sure that they work in teams, and talking about this in a didactic way, a practical way, and a clinical way. This has to be an institution level goal. It often doesn't work with a one-off program or lecture, things like that. So really thinking about the long-term sustainability, making sure you have champions at the faculty level, talking about relationships amongst other programs, making it part of your faculty retention packages, and then looking for long-term funding resources. So in conclusion, we know that we're going to be educating our healthcare workers in a multidisciplinary environment. We know that communication and collaboration will be the reason that doctors are better in the future. And the benefits of that is that we are going to be able to solve complex problems within an interdisciplinary team as opposed to one professional alone. So with that, I thank you for your time today. It's such a pleasure to be here, and I hope some of this resonated with you. Again, thank you to my collaborators and to Valeria for this truly amazing event. And I'll look forward to your questions once we get through the last speaker. Thank you.
Thank you so much, dear Claire, for your presentation and for your possibility to join to us. Thanks a lot. And we will open an opportunity to put the questions in our chat or via our email, and obviously we'll continue our communication.